So we'll have Dr. Tanuj DADA, sir. So he is going to speak on what factors besides conventional IOP leveling should I discuss with my patients. So this is very, very important, especially in the current scenario because yoga has become so popular, lifestyle changes have become so popular. And Tanuj sir is going to highlight how we have to answer the questions of these patients. Over to you, sir.
Can I have my slides, please? Good morning, everyone. So I'll be covering an important issue, what factors to discuss with your patient other than the conventional IOP lowering. And this is very important because you're often faced with this situation, apparently well controlled but progressing glaucoma patient. And it is important to establish that all the trials done for glaucoma, even though the target IOP is achieved, still a large percentage of patients continue to progress. So what are we missing? The first issue is that when we do office IOP, there is a very high chance that you miss the IOP spikes which are occurring early morning and late night. And this is very important that you explain to the patients that those who are progressing despite an office IOP which is controlled, that the IOP spike may be missed. So such patients, you need to do a diurnal taking into account early morning or late evening night IOPs. The second very important factor is what about the perfusion pressure, which drops at night. And this is one of the profiles of our patients admitted with the diagnosis of normal pressure glaucoma. But you can see there is a variation in the IOP, high IOP occurring at night, and that is a time when the blood pressure is falling. So this is missed in the routine checking of the IOP and the blood pressure. So it's important to understand that nocturnal hypotension is one of the risk factors why the patient is progressing, and a mean arterial pressure which is 10 millimeters below the daytime pressure is a significant risk factor which points that the patient may progress. And another thing which practically you can discuss with the cardiologist is that their antihypertensive medication, instead of taking at night or evening, shift to the morning if the patient is progressing and there is a nocturnal dip in the blood pressure. Another thing to discuss with the patient, especially if they're obese, is that many patients, their relatives may complain that he is snoring at night, and this is the outlier because these patients may be having a sleep disordered breathing, and that can lead to increase in intraocular pressure. So there is a high prevalence of this sleep disorder breathing in patients of glaucoma, and it's other way around also that this is directly linked to glaucoma. The good thing is that there is a obvious surgical treatment available for these disorders. These patients, if you refer to ENT, they can cure this disorder and the intraocular pressure also goes down. Just a word of caution, you should know that these patients are often put on CPAP therapy, which itself can lead to an increase in intraocular pressure, that the treating physician should be aware of this fact. Another thing which has come to be highlighted in the recent year is sleep positions. So if you get a patient who has got an asymmetric visual field loss, which is advanced in one eye, it may be prudent to ask the patient to not to sleep on that side, sleep flat or on the other side. And especially they should not put the arm with the eye, because if the arm is pressing the eye at night in the sleep position, so that can be very deleterious for the glaucoma because it can lead to rise in intraocular pressure. Some things we often miss, like I missed in this patient, this was my long-term follow-up, a retired Army general, and suddenly one day he came with very high intraocular pressure. I had no clue why the IOP has risen, and reluctantly a relative told me that he has been on this medicine for urinary incontinence. So in elderly people, whenever they come with high pressure, please check the list of medications they are taking, and you have to Google some of the medications because you are not be knowing that these medications can lead to intraocular pressure. So any medicine which is affecting the CNS and causing changes in the sympathetic, parasympathetic outflow, especially for prostate and all these psychotropic drugs, they can have even the anti-allergic drugs, which we commonly give like Allegra, they can also have a induce angle closure and cause a sudden increase in intraocular pressure. Now, what are the modifications? There was a very nice talk yesterday by Dr. Shanlin about the summary of the lifestyle changes, and this is becoming increasingly important because there is a resurgence of lifestyle disease. So I think what you can recommend is that regular aerobic exercise, at least half an hour a day, even brisk walking is sufficient. Meditation and relaxation techniques I'll just come to in a minute. Any form of leafy vegetables have high nitrates that can itself reduce the intraocular pressure. And what you have to warn the patient, those who have a family history of glaucoma, high caffeine intake, that means more than 2 cups of caffeine a day, may increase the intraocular pressure. Some of the professions like swimming, where they use swimming goggles, or performing head down yoga postures, and using high resistant wind instruments like trumpets, and of course weightlifting in the gym. If patient has glaucoma, then these activities can cause a rise in intraocular pressure. You should be aware and ask the patient about the specific profession that he is in. So this was very nice study that patients who were sedentary, if they start at least 40 minutes of exercise 4 times per week for 12 weeks, there was significant reduction in the intraocular pressure. So this is akin to giving a non-pharmacological therapy like an eye drop. So you can counsel your patients about this. So this, of course, you must warn the patient, especially glaucoma patient, that not to do head-down yoga postures that can lead to elevation in intraocular pressure. And some of the people come to us wearing a very tight necktie, so this can falsely elevate the intraocular pressure when you're checking in the OPD, and it's not recommended for glaucoma patients because it can increase the episcleral venous pressure and lead to a rise in intraocular pressure. One thing which we don't discuss with the patient, if they have got inferior field defects, especially bilateral, then there are risks to society, because not only are they at risk for motor vehicle accident, but they are more likely to be at fault. So because they're not able to see the objects, and this is also a risk factor for a hip fracture. So you must counsel the elderly and their relatives that not to keep any loose wires or furniture in the house, because these people can trip, and that can be very deleterious for the health. Finally, there is a very important link between stress. This is a blinding disorder, and stress can definitely lead to increase in intraocular pressure, both for normals as well as glaucoma patient, because it causes rise in cortisol, and glaucoma patients are already steroid responders. So this must be explained to the patient. The second thing which is often missed is that many of these patients with normal pressure have an autonomic dysfunction, which you don't come to know unless you test. This is one of the patients who was progressing, and in our laboratory at AIMS, we found that the autonomic function was deranged with a low heart rate variability, indicating sympathetic overactivity. So such patients can progress faster, and these are risk factors of why glaucoma is progressing. So autonomic dysfunction, there is no pharmacological therapy to reverse this, but just with 5 days of meditation with slow breathing, you can reverse the autonomic dysfunction in a glaucoma patient, especially if it's progressing, because slow breathing causes changes directly in the occipital cortex as well as the olfactory bulb. So that modulates the autonomic nervous system. So this is important to discuss with the patient. So just by breathing 365, 3 times a day, 6 breaths per minute for 5 minutes can lower the intraocular pressure. And you can counsel your patients to do at least 15 to half an hour of meditation with slow breathing that reduces the intraocular pressure. You can even use it for ocular hypertensive. So my take-home message is that don't treat glaucoma just as an eye. You need to optimize the health span of the patient, because this is a marathon. You're treating the patient for the whole life. So adopt a holistic approach to these patients. Thank you.
Thank you, Dr.